And I want to start off by saying, if you look at some of the debt drivers that we have here, if you look out into the future, there's issues with an expanding baby boomer generation that's going to eat up a lot of money from Social Security, Medicare. And that's why it's imperative that we had healthcare reform that I think is going to reduce cost and increase access. The main conversation we're having right now is, how do we figure out how we meet the benefits that we promise to our seniors? Because people have retired or are about to retire on a promise of Social Security and Medicare. And there is a great conversation that's taking place. How do we, in this current budget situation, meet that obligation? And we have to meet it. At a time when we can't figure out how we meet this obligation to our seniors, we have added more people on to the obligation of government by way of PAPACA or Obamacare or the health care bill that just passed, however you want to say it. And it's my view that if you look at what's happened in the health care reform bill, we have bureaucrats in Washington that are going to team up with bureaucrats in Wisconsin, but it's going to be driven from bureaucrats in Washington that are going to set up exchanges that are going to put up parameters of how we are going to receive our health insurance in Wisconsin. And I tell you what, I've met them. They don't know what's best for my family, my 6 kids and my wife, and I can guarantee they don't know what's best for you and your family and your wife and your kids. I think we need to have an insurance system where we in competition across state lines for the purpose of driving more options of insurance into the marketplace with less mandates. If I want to buy a low-level, cheaper insurance plan, I want people to compete driving an insurance product towards me and my family that works for me and my family. If I want to buy a gold-plated plan and pay $2 grand a month, provide that to me as well. Give me a ton of options, and I want people competing on price with insurance as they offer it to me and my community. But it will be based towards what I want as a consumer and my family. That's one component. The other component is the price component. If you look at healthcare, it's the one area that we don't shop on price and service. And I think we want to encourage doctors and clinics and hospitals to be concerned about us consumers who are going to shop for product and services on price and service. That doesn't happen right now. And if we have doctors and clinics who are trying to innovate and provide a service more cheaply because you're concerned about the price, and if you can find it for 50 bucks, down the street, you're going to go get that procedure potentially down the street. I think that's a good thing. And it's going to all drive competition in the marketplace with regard to healthcare. For example, in Ashland, you can get a colonoscopy. Not that you want to get a colonoscopy in Ashland. You can get a colonoscopy in Ashland for twice as much as you can in Superior. And I live in Ashland, so that's why I'm using this example. And they both do colonoscopies. They both provide a service, and they're both an hour away from each other. If you have complete coverage and you don't pay 1 red cent and you live in Ashland, guess where you're going to go? You're going to go to Ashland. But if you're going to actually pay or have some skin in the game for that service, where you might pay an extra $1,000 to get that colonoscopy, where are you going to go? You will drive an hour to Superior and have that procedure right there. If you're living in Amery and you want to buy an F-150 truck, and it's twice as much money here as it is in Rice Lake at that Rice Lake dealership, where are you going to buy the truck? You're going to go to Rice Lake. And the dealership in Amery would be shut up. They wouldn't be in business. But in Ashland, you have two providers, one charging far more than the other. Markets actually work. If we drive competition on price and service, I think we can bend the cost curve down, but we need to make sure that we're encouraging innovation and competition within the marketplace because we are all shopping with dollars. I think it's also important to say, with the proposal that I'm talking about, some people can't buy insurance. Some people need help, right? Well, I would prefer to say, whether it's a voucher or a tax credit, or let's help give people the power, the money, or the credit to go into the market and buy what works for them in the marketplace. And so then it'll be patient-centered, family-centered, community-centered, and not centered from bureaucrats in Washington, D.C. I think that's the way you'll end up getting results, by empowering people and not government.
You guys going to work on it now?
What's that?
Bush tried to push that through. Are you guys going to do it now?
Well,
The
we're going to do
credit
it.
for healthcare?
We're talking about reforms right now. And
Well,
yes,
Bush tried to do it and that got completely shot down.
I,
$5,000 credit.
well, I wasn't there then.
Well,
Let's see how it goes.
I'm not saying you were there. I've just heard this for years and years and years. And it never changes.
I'm going to tell you this.
Now we're 14 trillion
Yeah,
in debt.
let me tell you this. Republicans have dropped the ball. They had a chance to do something on health care and they didn't do anything. Democrats, they did something on health care. I don't like what they did, but they actually did something. That's a good thing. They've driven a conversation on health care. If you talk about the cost and the debt that we have right now, and you look at, and I'm going to give you both sides of the argument on PAPACA or Obamacare. I have to use both because some people are offended when I say Obamacare, but a lot of people understand it as Obamacare, so I'm using that term and I don't mean any offense to anybody. If you go from 2010 to 2020, it's going to increase our debt by $700 billion. If you go from 2014, when the plan is actually implemented, to 2024, it's well over $1 trillion of extra deficit spending. No doubt about those numbers. And which I would say is unaffordable. The other side will say, that is true. However, if we're encouraging people to get their care, to stay healthy, to get their checkups, we'll have a healthier population, and then actually, because we're healthier, it'll drive costs down. Some people agree with that, some people don't. If they're wrong, and you look at the structure that we have in place, it is absolutely devastating. And again, my concern is this. When you make promises to people, and then people rely on those promises, and then you pull that promise away, people take to the streets. They riot. Look at what happens around the world. Things become very crazy when you promise people things and you don't deliver on them. Let's not make promises that we can't keep. Let's be honest with each other. I think politicians come in and promise you the sun and the moon and the stars, and we can give it all to you, and there's enough money in there, and it's a bright, sunshiny day. And you can stick your head in the sand, but the bottom line is the debt is increasing, and we can't afford all that we're promising to our people. So let's be honest about it and go, what can we afford? And the first and foremost thing we should do is meet the promise to our seniors for their Medicare and their Social Security. That's the promise that we first have to figure out how we pay before we get anyone else on. So
I understand that if you changed the debt ceiling, I think it's called,
yes,
that would take care of that right away. But the people with the higher incomes do not want that debt ceiling raised because then they would have to pay Social Security tax on their income. And I can't remember the
I'm sorry. The question is about I think it's 106,000 cap on payments in Social Security. That's your question, right? And your point is, if you raise it, do we say, well, we're going to bring in a whole bunch more money? First of all, Social Security, and I'll answer the question in a second. Social Security is I think, fixable. There's different proposals out there that are debated. There are proposals that fix Social Security for those who are in retirement and those who are near retirement. They get the same proposal, the same plan that you currently have. There's a reform proposals out there that modify what my generation will get that fix Social Security. The problem and the cost driver becomes really Medicare. That's the 800-pound gorilla in the room. You can say, you know what, this is how we fix it. All we have to do is raise taxes. Let's increase taxes on those who make more money, and up to the tune of 12 to 13%. I don't believe that it's a revenue problem in this country. I believe it's a spending problem in the country. And I think we all want jobs, right? We all want prosperity. We all want to put food on the table. We all want to pay our mortgage. And a lot of us want to work for a business. We want to work for, whether it's a small business or a big business. If business is succeeding in our community, if business is thriving in our community, that means there's access to jobs, there's access to opportunity. I think we have to understand today, it's not like it was 50 years ago. We are not just competing against Minnesota and Michigan and Kansas and Kentucky. We are competing against China and India and Mexico and Vietnam. And the policies that we implement here in Wisconsin and in the country as a whole have an impact on what our businesses do. And I'm not hearing our businesses saying, we are leaving Wisconsin or we are leaving the country because of our workforce or because of the amount we're paying our workforce. What I continually hear is, you are over-regulating us, you are over-mandating us, and you're over-taxing us, and we can't do business here. You are driving us overseas because it's a more competitive environment there. They're not leaving because of us in the workforce. They're leaving because of policies in Washington and some in Madison. And I'll just give you a quick example. I was talking to the CEO of Microsoft, and they asked if I wanted to sit down and talk to them. I'm like, okay, if he wants to talk to me, that's great. There was 7 other freshmen congressmen there. And he talked about what concerns they have with Microsoft, but his main concern was that in China, they don't pay for Microsoft products. They pay like 10%, and there's no rules in place, so they don't make any money in China because they just pirate all of their technology. Another concern was this. He said, we educate the brightest minds in the world in America. They come to MIT, they go to Harvard, but we have an immigration policy in place where we send these people back to their country of origin. And they probably want to stay here. Let's have a policy in place that keeps the brightest minds in the world right here in America, so that next Microsoft, that next Intel, that next Google is going to be developed right here in America, not over in India.
Yeah.
They're concerned about that. But here's an example that he gave. He said, listen, we at Microsoft, we were looking at a major expansion in our company. And we considered we're a US-based company. We were looking at doing it here in America. But he said, to do that expansion here in America, it was going to cost us an extra $1 billion to do it here versus somewhere else. And the reason is, in America, what we do is, if you make profits overseas, or a global corporation makes profits overseas, when you repatriate those funds, when you bring those profits back to America, our government taxes those profits. And you all here might go, that's a great idea. Microsoft makes too much money anyway. All right? No other country is doing that. We are the only one. And what it does is, it encourages companies like Microsoft to keep their profits overseas, instead of bringing them home and reinvesting them in America. They don't want to pay that tax, so they keep it overseas. So what they said is this: when you calculate the tax of bringing that money home to invest in this new plant, the taxes we were going to have to pay on those profits, and then we calculated the extra mandates and regulation in America, we were going to have to pay an extra $1 billion for this expansion. So guess what they did? They're based in Seattle. They went right across the border, and they built their new facility in Vancouver, British Columbia. These jobs in Vancouver, British Columbia, look at the impact that that has on an economy and a community with good paying Microsoft jobs. There's an example of policies that we might think and go, it's a great idea, Microsoft should pay more money. But in the end, we start losing jobs because they're going, it's more competitive to go somewhere else. And they have the options to go other places. Let's set ourselves up with pro-growth policies that are going to allow our business to succeed and take advantage of our workforce and let them compete in the global marketplace. But it takes pro-growth reform in Washington, D.C. and in Madison.